Hello, Mr. Alatorre. My name is Jamie McCracken with Southern Crescent Technical College. Today, my speech is an informative speech over anxiety disorders and depression. Hello, family and friends. Today, I'm going to talk to you guys about anxiety disorders and depression. How many of you guys deal with this on a daily basis?
Me.
You do. What about you, Mom?
No.
No? No anxiety? No anxiety about what you're going to wear? No anxiety about if you have to get gas before you go to work?
No,
No anxiety about if you're going to finish your task on time?
Well, sometimes.
What about you, Kim?
I do.
Okay. All right. Well, according to the Anxiety Disorders Association of America, and doing my research, it's the most common mental illness in the United States. Anxiety can be if you're anxious when you wake up in the morning. It can affect your social life. It can affect your intimate life. It can affect the way you learn. It can affect your job. It can affect the way you speak. It can affect everything. And unfortunately, 40 million people in the U.S. over the age of 18 have at least one anxiety disorder. So you may ask yourself, what is anxiety? How do I know if I have an anxiety disorder? Well, according to Dr. Wu with Eagles Landing Family Practice, he says it can be the minute you wake up in the morning and you're already worried about something. You're already sweating, your palms are sweating, your heart is racing, you're worried about something. You could be worried about the day, you could be worried about next week, you could be worried about next month. And unfortunately, most people don't go to the doctor with anxiety. They think that they can self-medicate. They think that another medication is causing anxiety. They think that they're crazy. They think that they can help themselves. But reality, they need to go to the doctor to be seen. Oral medication can help you, as well as group counseling or just talking to a psychiatrist about it. Anxiety can affect children from 4 years of age all the way up to adults that are 30 years old. So if you feel like you have anxiety, if you feel like you can't be social, you feel like you can't, go do your daily job, you can't go out on the weekends and have fun with your friends, then you really need to talk to someone. And unfortunately, depression comes after anxiety disorders, especially if you are anxious about your work. Then you don't want to talk to anyone about it. Then you go home and you find yourself locked in your room in the dark, no TV on, no anything, because you're depressed. And that leads to more serious issues. So if you feel like you're anxious or you feel depressed in any kind of way, you definitely want to seek medical attention. And how you can do that is set up an appointment with a family doctor or go to a psychiatrist if you have insurance. If you don't have insurance, there's people out there willing to help you. So if you come to our office, for instance, you can see the doctor. He can talk to you, prescribe medicine, do a trial basis, maybe for a week or 2 weeks or a month to see if that helps you. If not, he can refer you out to a mental health specialist and they can help you. So you definitely want to talk to someone, take medication, or get with friends and maybe see if they have the common symptoms that you have and see if that will help. So some of the symptoms include that your heart's racing, your palms are sweating, you have a headache because you feel like you're going round and round in your head about some issue or some task or something that you have to get done. So make sure that you definitely talk to someone or get medical attention fast. So that is anxiety disorders.